very big hello to all my dear students. So, how was your NEET PG? We are here to discuss the recall questions of your NEET PG in ophthalmology, right? And I hope you all know me, I am Dr. Ruchi Rai. So, let us start with question number 1. So, of course, one thing that you have to be very clear about is these are all recall questions, and we are discussing on the basis of what you all are telling us is asked in the exam, right? So, let's start. So, according to you all, this was your first question, where a 4-year-old baby a 4-year-old baby had developed cherry red spot on the macula. Now, the child suffered from mental retardation and skeletal muscle weakness. Hepatosplenomegaly was absent, was not present, right? So, this was the question, and of course, the fundus picture of cherry red spot has been given here, and they have asked you the diagnosis. So, all of you, what have you answered? अच्छा अनुभव अभी वो भी बताते हैं, वो डिपेंड करता है कि कैसे आपकी इमेज थी. ओके, सो लेट अस go one by one. The second question is on dermoid and lipodermoid only. So, let us first talk about this one, right? So, yes, the answer you all know is Tay-Sachs. And why do you say so? I hope you all know, in a very small child, first of all, it is the age of the child, 4-year-old baby, right? Generally, Tay-Sachs even deteriorates within 2 years of the age. The patient deteriorates. You all know that. It's a neurodegenerative disease where there is abnormal deposition of gangliosides. We all know this? Yeah, and because hepatosplenomegaly is absent, which is also a very strong indication that we are talking about Tay-Sachs disease, right? I hope this is clear. Okay, so we all know that. I don't know, sometimes some of you are saying one of the option was Gaucher's, or some of you are saying it was not. So, even if it was Gaucher's, our answer would still be Tay-Sachs disease. I hope this is very clear to you, right? In Gaucher's and Niemann-Pick, of course, the presentation can be even in the puberty or in adult stage also, and we all know it's abnormal deposition of the lipids which is causing the problem, right? But yes, all these are causes of cherry red spot, whether it is Niemann-Pick, Gaucher's, GM1 gangliosidosis, or like in Tay-Sachs, which is GM2 gangliosidosis. Okay? Okay. So, once we know this, do you want a very quick recap of this one? Cherry red spot, I think we all have learned the cherry red spot and discussed in our different sessions in the class everywhere. So, when you talk about cherry red spot, we will quickly know that there are 3 main causes that we have to learn. Cherry red spot, what are the main DDs that we have to learn? We should know that one is your Berlin's edema, right? So, one is Berlin's edema which occurs after trauma, that is blunt trauma. And what is the second one? What did we know? Central retinal artery occlusion. And of course, the third that we learn here is your different depositions. This is how we learn. These are the different depositions. This is, I simplify and generally teach like this. And when you talk about depositions, we are talking about everything, whether we talk about Tay-Sachs, Niemann-Pick, gangliosidosis, GM1 gangliosidosis, or we are talking about your Gaucher's, right? So, this is again debatable. Many of you learn that it is not present in Gaucher's. It's not true. It is definitely a feature of Gaucher's as well. Okay? So, we will know this, right? Okay. So, another important thing, very quick concept here, that when you say cherry red spot, I hope you all remember this also, that why are you getting, because when there is edema, the very center of fovea does not have all the layers of the retina, right? So, there is no edema out there, and it is the background choroid which is shining white. Similarly, in all these depositions which you are learning, please listen to it, because maybe it will help you in the later. Of course, I wish every one of you to go through the exams and do very well in this, but still, why not to know about it? So, secondly, but you have to know this, that all these depositions are on the ganglion cell layer, and when it is on the ganglion cell layer is not present at the very center of the fovea, and hence you get a cherry red spot. Okay? So, cherry red spot is a very important topic, and here and there they have been asking you this, right? Okay, so this is clear to everyone. Yes. अच्छा ठीक है, बढ़ा दिया है, आप लोग को मन नहीं है, हम नेक्स्ट पढ़ते हैं. चलो लाइपोडर्मॉइड और डर्मॉइड पे आते हैं. So this was the next one. What is the likely diagnosis? Now it's quite confusing. What question I got was a very comfortable question where lipodermoid is not given, but I don't think this is the option. And one of the option was not retinoblastoma or lipodermoid, if you all say so, right? Now this is absolutely very important to understand here that what is the picture shown. So the picture here which is shown with this picture at the limbus, very overlapping. It's very difficult to comment. It could be a dermoid and could be a lipodermoid. Now, a few things which are in favor of the, if it is in the lower quadrant, inferior temporal quadrant, mostly are the dermoids. This is one thing, and lipodermoids are more on the superior temporal quadrants, right? And it should be more cystic. Lipodermoid has to be more cystic, and very important, it doesn't invade the cornea, whereas dermoid will actually invade the cornea. Lipodermoid can just be causing a simple astigmatism. By, as you can see, it is pushing on the cornea, but it's not invading the corneal tissue. Now it depends on exactly, Anubhav, what picture you got. If it was a simple cystic swelling, right, when it is a simple cystic swelling at the limbus, then it could be lipodermoid, right? But again, as I said, we are absolutely not in a position to totally pinpoint which it is because we haven't seen the exact image. Right? But these are some differences we will know, otherwise we all know both are choristomas and both can be, it is possible that both are present, right? Okay? If the picture did not have any hair in it, Anubhav, then we will answer lipodermoid only. So this was the picture I got. So if no hair is also there, then definitely our answer should be lipodermoid. So first of all, we all at least know this, that the option was not retinoblastoma, one option was lipodermoid, and simple cystic swelling at this, then please answer lipodermoid, right? Commonly you see dermoid or vital dermoid, you see the picture is something like this, we know this, right? Yeah. Okay, so this is what we should answer. We come to the next question here. Yeah, okay, so many of you are saying that there was no hair, so let us then answer as lipodermoid. Then we will answer it as lipodermoid, okay? Yeah. Just give me one sec. Okay, some issue with it, just 1 minute. Yes, if it is lipodermoid, then D is the answer. Yeah, then D is the answer. Okay, we come to the next question. Just 1 minute. Some small technical hitch, just give me 1 second more. Okay, so then we talk about the next question is a 65-year-old diabetic female with painless loss of vision over 3 years, right? So diabetic female 65 years, okay, these are some of the highlights of the question. On an ocular examination, findings is shown. So this, if it was, this is the type of radial spokes, if the image is this or maybe any type of immature cataract, the image had come to you all. Diagnosis and management of this condition. So what is the diagnosis and management? So this time combination questions are being asked and this is so simple and we have discussed this so many times in the class, isn't it? So what type of, normally it is a snowstorm, cataract and diabetes, but not always. As I told you, snowstorms are more common in type 1, isn't it? Yeah. So then what you should answer here? Of course, the answer will be immature senile cataract, and of course we will go for phacoemulsification with IOL. That is the choice of surgery we would like to do, isn't it? I think it was simple. If you look at this, we have already discussed the different types of the cataract. So this one being the matured, it was in our marathon session also we revised everything. This was Morgagni and this is immature, and this is your nuclear cataract, right? One of your options were lamellar, but you all know lamellar is mainly a congenital cataract. So lamellar being a congenital cataract, and here we are talking about a 65-year-old diabetic female, right? So there shouldn't be any confusion in this. Then talking about sunflower cataract, we all know that is seen in Wilson's disease, right? Or any cause of calcosis, correct? So again, it's not related to diabetes. So, and rosette shape, we all know this was seen in blunt trauma. This one has also been discussed in your, I have discussed in the class already. So this was discussed as blunt trauma rosette shape cataract, right? So looking at this, we know that what you should answer should be immature cataract only. Okay? Yes, the answer is B. Tobramycin, rosette की जगह tobramycin था. So tobramycin का क्या role होगा when you are operating a cataract or your recall? So how does that rosette with tobramycin, something like this? You're saying it doesn't fit here anywhere in the question anyway. Okay. Okay. So then we talk about next is your next question. Let's talk about the next question then. What was asked is this one. Where is the likely lesion if the patient cannot see the right visual field images from both eyes? From both eyes, one-sided field defect. So this time it is a right-sided field defect. So many times discussed in the class, even revised in the marathon session also. So when you say that it is a right-sided field defect, we are always talking about left-sided lesion. Is it correct? So when you say left-sided lesion, what it is saying? Right side, let's make it for you. This is left side, this is right side. Right-sided field lesion would be shown something like this. ठीक है? So if this is the right-sided field lesion, what type of hemianopia? So right homonymous hemianopia in both eyes, है ना? When it is in both eyes same, it is called homonymous hemianopia. When it is in the same direction. So do we all know homonymous hemianopia can be caused by optic, bolo, tract, radiation, cortex, right? So what are the options given here? And it will always be opposite. So what are the options given here? It is your right visual field images from both eyes, isn't it? So most commonly we should answer left occipital optic tract, sorry, right? So left optic tract will lead to right homonymous hemianopia. Chiasma will not do so, and right-sided optic nerve doesn't make much sense. If it had been an occipital lobe, they should have mentioned macula sparing homonymous hemianopia or this type. That should be specific. So I would prefer to answer left optic tract. Right? So I think you all are talking more to yourself. Anything I want to answer here? Huh? So yes. Okay. No, whenever it is in the same side, it has to be homonymous. I mean, one option was bilateral type. Okay. So no. So again, it is. Sorry for this. So again, this is mainly your right homonymous should be the answer. Okay. Sorry for this. Okay. Next we talk about what is the next question here. A newborn child with big blue eyes and watering, big blue eyes, with watering. Why do you say so? Blue eyes, thinning of the sclera, uveal tissue is visible maybe, right? Ophthalmos, big eyes, and watering and blepharospasm and photophobia. Of course, we are talking about congenital glaucoma. And I think this was an IBQ and the image was given to you all. So here what you will answer, and he is a newborn child. I don't think there should be any confusion here that our answer has to be this. The presentation will not be so in other types of options that are given. Of course, not in cataract, ophthalmia neonatorum. If it was given as an option, this is what I got. If ophthalmia neonatorum was given, again ophthalmia neonatorum, you all know, will not be presenting with big blue eyes, right? So everything is indicated towards congenital glaucoma. We are talking about ophthalmos, right? And what is the most treatment of choice of ophthalmos? I hope you all know. Yeah, goniotomy. Right. So we will answer here congenital glaucoma. We come to the next. Next question here. An elderly patient with decreasing far vision but does not need near glasses now. What is this? Batao? Second sight of old age. I have been teaching in the class so many times where there is improvement in the near glasses. He may not be needing the glass, or there will be improvement in the near glass. So we are all talking about what? So what is second sight of old age? So many times discussed in the class also that whenever there is a nuclear cataract, the refractive index is going to increase. And when the refractive index will increase, there is more power. So you need lesser power in your presbyopic glasses. So are we talking about index myopia? Yes, increase means myopia, towards more power is myopia. So this becomes an index myopia, right? So this will be the answer for this question. Everybody remembers this? Yeah, answer is A. Very good. Yeah, correct. We come to the next one. Identify the stain with light as shown in the image below, right? So what is the image here? Was this the exact image? I am not sure, but this is what I got. So what do you see? Fluorescein. Fluorescein dye is generally seen in cobalt blue filter. What does the fluorescein do? What is the property of fluorescence? Right? It takes a small wavelength of light and emits the larger wavelength of light. So in the Vibgyor, if you see, if you show blue light to the dye, what happens? So you all should remember the spectrum. So when you are showing the blue light, what it emits is a green one, right? So larger wavelength. So we are typically talking about cobalt blue ke through, we generally see the fluorescein stain. Okay? So I think the best option will be fluorescein dye with cobalt blue filter. Blue dye and green staining, this is something not, doesn't make much sense. Again, Lisamine green, I would still prefer to go over this as fluorescein staining, and cobalt would be the filter with Lisamine stain. It will be first fluorescein stain because the fluorescein which fluorescences like this, right? And we need a cobalt blue filter for this. Okay? So we will answer this. Image was also there, Gaurav? Okay, nice. What, Ravi, what was the question? Binasal vision loss. So binasal vision loss with space occupying lesion, and they asked the compressed, okay. So if you were saying, so just send me the full question, I'll just have a look at it, what you are trying to say. So bitemporal hemianopias is generally due to, binasal means both side temporal lesion, right? And when you say binasal, it is both like, both side, it will become, so when you say nasal fibers are decussating and the lesion is in nasal, you get a bitemporal hemianopias. You are asking me binasal, that means both side temporal there is some lesion. So this is how we will think, it's a very rare condition. Yeah. I think we will pick up the commonest, Gaurav. We would like to pick up the commonest, and generally we need this fluorescein is one of the commonest used, and if that is given in the option, we will mark that. As you see, discussed whether you are using it to see the geographical ulcer, here we were discussing, or we are talking about your dendritic ulcers, we always use fluorescein dye and we see through cobalt blue filter, right? Okay. And we don't particularly need typically a cobalt blue filter for a Lisamine green also. That's what also you have to keep in mind, right? We will need it more for fluorescein. So that's why we will prefer fluorescein. Okay, Gaurav? Yeah. नहीं ऐसा नहीं होगा शालू, इसमें कुछ आपको गलत, कोबाल्ट ब्लू ही होता है, वो फिल्टर कोबाल्ट ब्लू होता है. Okay, Ravi, I'll just DM me, I'll just have a look at it and give me the options, and I'll just try to come to you, right? Okay, we come to the next question is brown ring around, okay, was it brown ring around iris or it was brown ring around cornea? Because when you say around iris, it doesn't make much sense. Reason being, because even if it is a siderosis and there is an iron deposition on the iris, it is not in form of a ring. right? So if you see here, I think they ultimately mean Kayser-Fleischer ring and copper deposition only. So that is what makes sense, nothing else makes sense here, okay? So whether debatable hai, some of the students are saying around the cornea, some are saying around the iris, but siderosis, again iron deposition is not in form of a ring. So if it is a cornea, absolutely fine. On the Descemet's membrane, this is copper deposition, and we all know that we have discussed it in a revision session also, that this is what is Kayser-Fleischer ring, haven't we? So this is what is Kayser-Fleischer ring, which is copper deposition, calcosis, and we had discussed the sunflower cataract also. And of course, major reason being Wilson's disease, and how do you really want to investigate for Wilson? So our answer becomes serum ceruloplasmin. Okay? So this is the reason the answer is serum ceruloplasmin. I think this was simple, and KF ring has become their favorite question. Like every year recently they have been asking questions on KF ring, or maybe they are a little less creative. KF ring koi leke idhar udhar se, हाँ, right? So we are just asking those same questions. Okay. So, okay, even if it is around the iris, we are going to take this only, because I don't think this makes much sense, because as I just explained to you, A1, just I explained to you that it is mainly irregular deposition if we talk about the siderosis part, okay. Yeah, yes, Rockstar Sagar. Okay, so we come to the next question here. So this was the next question. What is this question here? That which of the following is depicted in the picture? What are you looking at is terms conoid, na? So many of you wrote this, that we had a graph. So this is the graph, na? What is this showing you? We have discussed so many times about astigmatism in the class, right? We have talked about in detail about astigmatism. So I've just taken a better picture to explain you. So one is a vertical meridian, the red line is focusing before here, and look at this is the horizontal is the blue line which is behind the retina, this is your retina. So one is in front, one is behind. So two focal points, it is multiple focal points is what? Astigmatism. So it was a very, very simple question to you. We had to answer astigmatism, right? Yeah. And if there was anything like CDE, what is CDE indicating? Again, look at the same thing. If it is, we are talking about CDE indicating what? Some of you are saying it was written like this. Even if it is asking this way, we see one is focusing of the red is in front, focusing of the blue is behind. So it's a mixed astigmatism. One axis is hypermetropic, one is myopic. We have discussed all this very nicely in our revision as well, right? So I think these were the questions. One of the question was, I think, around frontal mucocele, which is an overlapping question where there was a non-axial proptosis. Was there some picture also, image there? So I think it's more of a radiology question. So you can discuss that there with your radiology faculty, right? So this was all. So if it was asked just like this, CDE was not asked. So it's a very simple question. It is telling you that this is we are indicating astigmatism. Right? So very quick review once again. So here the answer is astigmatism. Here we are considering it to be the KF ring, and we will be answering serum ceruloplasmin as diagnosis as Wilson's disease, right? Okay, then this is the most commonly, of course, we are talking about fluorescein dye with cobalt blue filter. So we should answer this. Coming to this one, we are talking about second sight of old age, right? So index myopia, where the refractive index of the lens is increasing, and because of that the power is increasing. When this is increasing, the power is increasing, so you need lesser number on the specs. That's why near glasses are decreasing. So this is your index myopia. Okay, we come to the next one. Here we all know when you say large blue big eyes, we are talking about ophthalmos. Therefore our answer should be congenital glaucoma. Though of course a patient of ophthalmia neonatorum may also present as watering. I hope you know the DD of watering in a very small child can be congenital glaucoma, it can be nasolacrimal duct obstruction, or it could be your ophthalmia neonatorum. But here again everything, all the description goes towards congenital glaucoma, and I am not very sure what the options were anyway. Acha. Okay, so Shalu, even if you are saying that the cataract was very white, or even if it was a mature cataract, still if you are seeing the history of in this question was 65 years old female diabetic, would you like to answer sunflower or rosette shape or lamellar or zonular? No, na. So if you're not, no, you don't want to answer that, that means your answer even by exclusion goes towards this immature cataract with face. Of course, you want to say that it was not immature, right? But then there should be some surrounding history also, na? So your point is it was not immature, that's what you're saying. But okay, if let's go to this question first, Shalu, that if it was not immature and if this was the exact question, even then diabetic female 65 year, should I say rosette? No. Sunflower, why will I, diabetic and sunflower are not even related. Zonular, it becomes congenital. So maybe the framing of the question I would say is confusing, just to confuse you. But even by exclusion we land up into this answer only. ठीक है शालू? आपको वो immature नहीं लग रहा था, I got it, but other causes are also not fitting here. ठीक है? So we answer this, and yes, we had one question on, of course, visual field defects. We generally have a question, neuro-ophtha, our favorite topic, and what you see here, very, very simple. It's always opposite, na? Left-sided lesion will lead to right-side field defect, right-side lesion will lead to left-side field defect. Nothing big, and it should not be a cause of any tension, right? So this is very simple. So I think this was quite simple. And I am not even sure about the options, maybe it was right optic tract to confuse you instead of right optic nerve. That would have been a smarter thing to do, isn't it? So, what were the options? Yes, Aparna. So, cherry red spot most common cause, options were Tay-Sachs. So, again in Tay-Sachs they had given you some, in cherry red spot question they have given you some history, na, which is significant towards the diagnosis. Let's see. So, if you look here, first of all a very small child, right, with all the mental retardation, skeletal muscle, with no hepatosplenomegaly, then what would you answer? Isn't it? No hepatosplenomegaly goes too much into favor of Tay-Sachs disease. Thoda sa uska systemic features you have to revise. Okay, Panna? What did you say? Healthophiliac, interesting name. One question was flame-shaped hemorrhage. Are we talking about flame-shaped hemorrhage in hypertension patient? Flames, you are saying? Is it flame-shaped hemorrhage in a patient of hypertension? So maybe splash sauce appearance. This question hasn't come to us at all. So if there was any question, you can just DM me. I will just look into it. And Ravi, I would like you to DM that question to me, please. We can discuss it anyway. I can put it on the. I can discuss it later in the class. Gaucher's, yes. So I have already taken that even if it was a Gaucher's disease means hepatosplenomegaly becomes one of the prominent features. So again we should not answer Gaucher's. Okay, Aparna? That's the reason we are answering Tay-Sachs. So we needed to know some of the systemic features of these diseases, though we knew that in the DD that all these are the causes of cherry red spot, isn't it? But we had to know this. Right? I hope everything is clear. Cherry red is discussed so many times here also. Yeah, so the debate is still on between lipodermoid and dermoid. I agree with you, but what I feel, if the hair was not there and it was just a cystic swelling on the limbus, we can answer lipodermoid. Okay? Then we can answer lipodermoid. And here I got a question where lipodermoid was not even in the option. I think this is wrongly framed then, because you all are so concerned about this. So we will exclude this and we will consider D option as lipodermoid, and in that case we can mark that as the answer. हाँ, इसीलिए बोल रही हूँ hair नहीं था तो lipodermoid answer कर दो. Yeah, so we will answer lipodermoid. This will be the answer. ठीक है? I think I've marked ना. I'm talking and हाँ, ये मैंने mark कर दिया. One is Tay-Sachs हो गया. फिर इसमें आप mark करोगे lipodermoid. And anyway, there is no corneal involvement, and which goes more in favor of lipodermoid. Okay. This is orbital award, just to show you that this is what you have discussed till now. So we have been learning this as one of the most common intraorbital benign tumors in a small child, right? Now the commonest that you have to say is capillary hemangioma. Dermoid comes at the second number. Yeah, and then we talk about this one. This was immature now. So if it was a mature cataract image, then definitely your point is correct, but by exclusion also we have to mark the answer as B only. Yeah, congenital glaucoma, so I told you, Subhash, we have discussed that. So Arjun, if the swelling was not involving the cornea at all, it even goes more towards lipodermoid only. Okay. That was, acha, there was a child at a very long distance, okay. Yeah. So we can just quickly just remember this, that lipodermoids are generally associated with golden hour syndrome, right? So 1 or 2 points additional that we have to keep in mind about this is pingicula, and I think pingicula and of course pingicula will, if it pingicula and pterygium look very, very different, right? We have discussed in the class. So that looks very, very different. I have not included the slide here to show you, but I think everybody is clear what is a pterygium and what is a pingicula. So even we have revised this in our marathon. So you should know that we are not, it cannot be these two. So ये तो बहुत clear है कि ये नहीं है, ठीक है? Dermolipoma or lipodermoid are same thing. Mainly it is a fat tissue covered by a connective tissue. It is mainly a pathology of the conjunctiva, ठीक है? Associated with golden hour syndrome. These are the points that you will remember. That's it. Thank you, Subhash. Made my day. Yeah, photophobia. I've told you, no, a patient of congenital glaucoma, how will it present? He will present as photophobia, right? So this should also not be a problem. So this will be this only. Okay, I think we are done with it. We are just again and again talking the same thing. Any new question? Otherwise we are over. We have done this. This will be index myopia, but there is no confusion in that as well. We are only left with one confusion about dermoid and lipodermoid, which depends upon what was the clinical picture. But I think even there we go more towards our lipodermoid or dermolipoma, right? Thank you, Subhash. That's great. Thank you, Samath. Stay blessed, all of you. Now relax, chill a little bit. A lot of studies have been done. You all deserve to just enjoy your day. Till the result, just relax. Don't worry about anything. It's over, right? Not every day should be the same. That if we are studying every day, right? So just enjoy yourselves. Okay, so thank you so much. Let's end it now. I think now all the confusions are clear. I hope so. I was able to clear your confusions. So any other confusion left, or if there is any question you feel you remember later and you want the answer, you can just DM me, okay? I'll reply you back. Yeah. Thank you so much. Thank you. Stay blessed. Keep smiling.